Hi, I'm Shivan Sarna, and it's a pleasure to have Kiran Krishnan with me today. I met Kiran in one of my summits that I've done now 11 of. The New Science and Wisdom of Menopause Summit is about to happen this month. I'm very excited. And Kiran's in that as well, talking about the menopausal microbiome.
Mhm.
He's truly a world leader when it comes to the microbiome. He co-founded Microbiome Labs. He also is one of the most prolific educators in the world about microbiome. He teaches other practitioners and researchers about the microbiome. He co-founded Microbiome Labs, phenomenal, megaspore, changed the world, continues to do so. He still educates for them, by the way. He still is there at their conferences, etc. So it's all good. He just has gone on to expand. And to expand his reach, he's teaching this very special course. He's going to have a ton of free content right now. And then he's also worked with a skin treatment, which we'll tell you about another time. Kiran, take it away. Thank you so much for being here.
It is my pleasure, Shivan. I'm always excited to get to do anything with you. We've always had a wonderful time ever since I met you. So thank you so much for having me. And this particular talk, and then what we want to offer you after the talk is a culmination of the last almost 12, 13 years of just dedicated teaching on the microbiome, day after day, week over week, month over month. Right? On average, I was flying around 400,000 miles a year, doing about 65 in-person lectures, about another 100 or so online, everywhere for years. And I had the privilege of working with a lot of brilliant practitioners who focus a lot on the microbiome. So I got to learn some of the stops and issues and roadblocks that they deal with. And then I've also got to engage with a lot of patients, a lot of people that, come to me with hundreds of questions and complexities to their issues. And one of the most, common things that I'm asked is like, where do I start, right? My gut is, I'm experiencing this. This is my history. It's all quite complicated. Where do I start? And where do I find this information or that information? And if you go on my page on Instagram and Facebook, there's a lot of information out there, but it's not put together in a concise manner that allows you to follow it in a constructive way, right? And at the end of the day, here's what the most important message is with regards to the gut: is achieving gut health, true microbiome resilience, and gut health is a series of small decisions that you make each and every day. Then the question is, what are those decisions, right? How do I know what to choose? What food, what this, what that, what behavior, what activity? All of that knowledge comes from understanding how everything works, understanding how the microbiome works, how it influences the different body systems, how it influences disease pathologies, where things can go wrong, what are the things you're doing that create issues, and what are the things you're doing that can enhance issues or enhance, recovery. And at the end of the day, it's a series of small decisions that you make each day. So, and that has become clear to me because, there's no miracle pill. There's no one, biohack that you do. There's no even set of those things that you do that will just change everything. It's a series of decisions that just pushes your ecosystem towards resilience. Your ecosystem is constantly being pulled towards vulnerability and dysfunction. You just need to start making decisions to push it towards resilience. And giving you the foundations becomes a really, really important part of what I do, because then you are empowered to know what decisions to make on a day-to-day basis. And we'll get a little bit more granular on that as we get to the end of this. So what you can expect from this talk today is to give you a really strong foundation and what I call the 5 pillars that you have to focus on in order to rebuild the resilience within your gut microbiome. And this doesn't matter how complex you think your case is, how different or unique it is, how sensitive you are to this, that, and the other. It doesn't matter, right? We have overcomplicated so many things about the gut by looking at the gut in a very allopathic-like fashion. We need to get back to basics, right? So I really want to hone in on those basics here today. So at the end of this, you'll already have a very strong understanding of how your gut microbiome is impacted by what, and then how that impact leads to dysfunction in the body. And then we'll talk about the 5 pillars. What are the types of things that you need to be doing on a regular basis in order to shift and push your microbiome towards resilience? So let me start the broadcast here, and then I will jump into the slides. Okay, I'm sure you can see this here.
And a reminder that this isn't medical advice. This is just some educational resources for you to use with your practitioners, as well as to be able to access some over-the-counter things, etc. So please just be aware when you are asking questions. I hate to say this, but if it is like a doctor's visit question that's like about surgery and the like, well, we would love to be able to help you. Truly, it's beyond our scope. However, I can we'll do our best. That's what I have to say. We'll do our best. We love you.
Yeah.
Well,
we'll try to point you in the right direction.
Yeah.
Right?
We'll point you in the right direction to the best of our ability. That's what I meant to say. Thanks.
Yeah. And the thing is, I have tons and tons of great practitioner friends, and I've worked with a lot of practitioners. Even they are excited to know that if their patients know this kind of information before you go to the practitioner, it makes their job so much easier, because then they can kind of work in on the more specialized issues, without having to go back and try to redo the foundations, right? So that's why this is so relevant to everyone here, and everyone that suffered from any sort of, or is suffering from any sort of gut issue, immune issue, metabolic issue, skin issue, anxiety issue, and so on. This information is very relevant. So these are just some of the things you want to do as you're trying to focus in on a presentation. Just comfortable space, close other windows and alert things. We all have ADD and we get distracted very easily. Turning off those notifications are important. Taking notes. If you take physical notes, great studies, including a recent Harvard study that shows that writing down notes actually makes you remember things almost 8 times more than typing in notes or doing it some other way, right? Now we have AI note takers and all that, but writing notes is very valuable. And then place your questions in the Q&A. Hopefully we'll have time to get to them. If not, we'll figure out a way to get them answered to you, right? And this is me. I don't think I want to spend too much time on this, but I've been dedicating my professional career over the last 15 to 20 years to educating on the microbiome. Really, at the end of the day, my goal is to empower people with this information so you can make those right choices every single day. So you're going to learn how poor digestion and microbiome health are linked to almost every form of chronic disease, right? It's the #1 cause of mortality, according to a meta-analysis in 2015. You'll get to take a little bit of a deep dive into the gut microbiome and the connections to things like hormonal problems, autoimmune disease, chronic pain, metabolic syndrome, and so on. We'll touch on each of those. And what kind of pathologies are driven. You'll learn why long-term restrictive diets, really harsh killing protocols, and that big supplement graveyard that you might have in your cabinet of all the various things you've tried, why those things may not be working so well or even maybe doing harm. We want to go beyond that and look at some fundamentals and look at the types of things you should be engaging in to improve the resilience within your microbiome. And you'll find out the real cause of what poor gut health and microbiome health looks like, right? And then we'll bring up the 5 pillars of building a resilient gut microbiome so that you have this stable, long-term, healthy and very vital system. And that's really all we all want. That's what we ask for, right? And of course, we'll give you a really exciting and awesome bonus and opportunity at the end of this as well. Now, this is what most people think microbiome issues look like, right? We associate them primarily with symptoms in the GI or toilet issues, urgency issues, maybe some upper GI issues like reflux and so on. But in reality, it goes well beyond this, right? So these are issues that are, of course, directly microbiome related. However, poor gut health and microbiome issues also look like all of these conditions, right? Microbiome issues and poor gut health issues are primary drivers in virtually all of these conditions, right? Immune dysregulation, like autoimmunity. You might have a genetic predisposition, but you need a dysfunctional microbiome and thereby a dysfunctional immune response in order to trigger an autoimmune cascade, right? So for everybody that's dealing with some degree of autoimmunity, whether it's on your skin, whether it's something like lupus or Hashimoto's or one of those things, you know that the microbiome is involved, and thereby you need to address the microbiome part of the issue. Chronic pain, weight gain, and metabolic syndrome. There's lots and lots of studies now on how certain types of biomes induce more weight gain and restrict calorie burn and reduce fat burning in the individual. There's some great studies on what we call discordant twins. These are identical twins, so the exact same genetic material, but one is overweight, one's lean, and then they can study the microbiomes of these twins. They can take the overweight twins microbiome and put it in mice, and take the lean twins microbiome, put it in genetically identical mice, and then feed them all the same exact diet, same calories, same timing. And the mice with the obese twins microbiome always gains weight. And the ones with the lean twins microbiome always stay lean, right? So those were some of the studies that were started 15 years ago. And since then, that it's expanded quite a bit from there, really showing that the microbiome plays a big role in weight gain, obesity, and so on. We know the microbiome is like the first phase of detox. And so when you have a dysfunctional microbiome, you really negate a huge aspect of detoxing your system from all of the potential toxigenic things that come in through food and water and drinks and contaminants and even breathing and so on. Then that, of course, puts additional pressure on the liver. So now the liver is dealing with much more toxicity. And on top of that, when you have a dysfunctional gut that's not detoxing properly, you likely have a leaky gut. So now not only is your gut not detoxifying the things that are entering into your system, but the gut is also adding more endotoxins to the liver, right? And I'll elaborate on that. Acne and skin issues are directly associated with the gut. Hypersensitivities, mast cell activation, histamine intolerance are all immune-related issues that stem in the gut and the relationship between the gut microbiome and the immune system. Mood disorders and anxiety and depression, those are all gut-brain issues driven highly by the gut. Neurodegenerative conditions, so Alzheimer's, Parkinson's, these are all conditions that are also driven heavily by the gut. Chronic infections and illnesses, the susceptibility to infections is a gut-related issue. This was very clear, for example, in COVID. If you took, for example, a 50-year-old with diabetes and you compared the risk of mortality of a 50-year-old without diabetes, the person with diabetes had a 10-fold increased risk of dying from COVID, even though they were the same age, and all other health things being equivalent. It was just the diabetes alone that increased their mortality. Now, why would that be, right? And what the studies have shown, and a lot of this comes from the lab of Dr. Liam Mahoney out of University College Cork, where they were able to show that people who had the worst outcomes on COVID, who had the worst infections and had high risk for mortality, that had high risk for long COVID, had a particular type of microbiome with a high degree of pathobionts compared to the commensals. So these are opportunistic organisms that are normally there in the microbiome, but their proportion was greater than that of the rest of the commensals. So they had a dysfunctional system. And in that dysfunctional system, the presence of a new virus or bacteria or of an infectious agent creates a havoc that makes it so much harder for the body to heal. In the individuals with a higher degree of commensals compared to pathobionts, their body dealt with the virus perfectly fine, right? So if you had higher levels of pathobionts, it also means you're metabolically vulnerable. That's likely why those individuals are diabetic in the first place. And then that same microbiome dysfunction also drove the vulnerability of the infection as well. So having a healthy microbiome is absolute defense in your system. And then, of course, blood sugar regulation, diabetes, the primary insult, according to the American Diabetic Association, which these big associations are normally decades behind on progressive research. And so what they have concluded from papers that they published in like 2017 and 18 is that the primary insult that starts the pathway down this diabetic route is a change in the microbiome and then the resulting leaky gut. right? Hormone imbalances, so things like PCOS, infertility, estrogen dominance, low libido, and so on. Those are
Whoa,
all
whoa,
driven by
whoa,
the
whoa.
microbiome.
Are you telling
Yep.
me that metabolic, did you just say that metabolic disorders are from the microbiome? Can we just have a moment to absorb that?
Oh, like 100% metabolic disorders are from the microbiome. Yeah, absolutely. I mean, not
Thank
only
you. I just had to hear it again. Oh my gosh, I don't want to break your flow, but
no worries. It's really important to underscore that because when we think about the number of Americans, the percentage of Americans that are metabolically healthy, the latest estimates is that it's less than 15%, right? Because there's different degrees of metabolic dysfunction and unhealthiness. So there's obesity, which most data sets show is about 60% of people. 60, maybe upwards of 70 if you look at different cutoff points for obesity. Clinically obese is certainly 40, 50%. And then, marginally obese, BMI over 30 plus is going to be upwards of 70%. But then metabolically unhealthy, which means not only that you're obese, you may not even be completely obese yet, but you have blood sugar dysregulation, which means you have high fasting glucose, you have elevated A1C. It's not all the way to diabetes yet, but it's getting close. It's pre-diabetic. You've got a lot of inflammation. You've got a poor functioning immune system, and you're not efficiently burning calories. Those are all within the metabolic syndrome's umbrella. That's like 85% of Americans, right? And that is one of the biggest underlying risk factors for all other chronic diseases. And those metabolic conditions are all driven by a dysfunctional microbiome. So it's really mind-boggling when you think about the impact it has. Nutrient deficiencies, of course, because a dysfunctional microbiome negates the proper assimilation and absorption of nutrients, brain fog, inability to focus, and so on, all of those things driven by the microbiome. Now, what is the consequence, the main consequence of having a dysfunctional microbiome, right? This is where the rubber hits the road on how your dysfunctional gut and your non-resilient microbiome or your dysbiotic microbiome can lead to disease pathology. This is what we really want to focus in on. And so let me use just a little, pointer thing here to help illustrate this. So some of you may have seen this already, but I just want to reiterate it. This is kind of a depiction of what the lining of the gut looks like. It's a little bit different between the small and the large intestine. In the small intestine, remember, you've got these finger-like projections called villi and microvilli. There's a thinner mucus layer on the small intestine than compared to the large intestine. In the large intestine, those finger-like projections are kind of inverted. They're called crypts, and they have a thicker mucus layer, right? But generally, this is the same structure and same idea between the two. In that mucus layer, you've got this inner mucus layer, and then you've got an outer mucus layer, right? So this is often referred to as mucin 2, and this is the outer mucus layer. What you'll see here is that the colors are different for a reason, because the inner mucus layer is a thicker, more dense structure, and it tends to act as like a wall to try to slow down and or prevent the transmission of things from out to in, right? So remember, out here is a tube in the intestine. So that's where the food and everything passes through. And for something to truly be inside the body, which is down here, now you're in that enterohepatic circulation, which is once things pass through there, about 85% of those things go to the liver, and then the liver deals with it before sending it into circulation, but about 15% makes its way directly into circulation. So nothing is truly in your body until it's down here, okay? So it has to go through this outer mucus layer, inner mucus layer. These are the intestinal epithelial cells. These are the final barrier before things are officially in your body. And among the intestinal epithelial cells, you've got immune cells that dot it, and then you've got these goblet cells that make all the mucin, and then you've got tight junctions in between the cells. These are the gaps in between the cells that can open up when they need to let bigger nutrient particles through, or stay cinched up and closed, not allowing egregious things through the system, right? So this is what a healthy gut looks like. The vast majority of microbes live up here in this outer mucus layer, and you want to keep this layer relatively sterile. It's in fact one of the only sterile areas of your body. Everything else in your body has microbes in it, but the area directly adjacent to the highest concentration of microbes is the only sterile area in your body, which is crazy to think about. So this is a very deliberate structure. Now, one of the reasons for that is because these immune cells that are within your intestinal epithelium are constantly monitoring the actions of the microbes up here. And what they want is they want to maintain some degree of space between them and the microbe, right? The reason for that is that if these microbes start penetrating here too much and then ending up inside here, you're undergoing sepsis. Sepsis is really a scary thing, right? Nowadays, with modern medicine, they can save, I would estimate, about 50% of people with sepsis. But imagine back in the day, through the course of evolution, if you become septic, you're done, right? There's no way you're surviving. It's probably 100% fatal. So sepsis is a very scary thing for the system. And you've got 40 trillion or so microbes here. You've got one layer of intestinal cells, and you've got blood supply down here. These cells are very cautious about what may move through, right? So they like this separation. This inner mucus layer is really important. If all things look like this and the right balance of microbes exists, there's an amazing communication between the immune cells and the microbiome down to the immune cells. The microbiome's telling the immune cells what's coming in, what's a problem, what's not a problem, who they should tolerate, who the immune system should tolerate, and what the immune system should tolerate and what it shouldn't. So this is all called crosstalk. And then in response to signals from the microbiome, the immune cells here may produce antimicrobials and antibodies and all of these kind of compounds to control and make changes to the microbial population up there, right? So this is everything being hunky-dory. Now, when you look on the right side here, you've got more of a leaky gut. So let's say something affected these microbes, and let's say a course of antibiotics or bad food choices over a period of time or elevated stress, you start to get a shift in the types of microbes that exist here, and you tend to get an increase in pathogens or dysfunctional microbes. When you get an increase in those microbes, one of the things that they tend to do is they eat away at this mucus layer, this inner mucus layer. They love this layer because it's great food. It's proteins, it's sugars, it's moist, right? So they eat away at it. And as they eat away at it, this proximity barrier gets lost, right? So now the outer mucus layer starts to flow in, and with it comes the trillions of microbes and the food particles and all of that. So then the immune cells that are dotting this area freak out because it sees this big thing coming through and it thinks the host is undergoing sepsis. So what it does is it recruits all of these immune cells through inflammation, which is a recruitment tool for immune cells. They come up here and they just start attacking and bombarding everything, right? Because the immune cells that are acting are called the innate immune cells. They are the ones that show up first, but they don't know exactly what's causing the problem. So they use a big blowtorch to just kill everything. Right. So it's like killing mosquitoes that enter to your house with a blowtorch. You'll definitely kill the mosquitoes, but you'll probably burn the wall as well. And so you've got the immune cells here freaking out that there's too many microbes coming too close to the border. And then they upregulate the immune system. The immune system that shows up is the pro-inflammatory innate immune system. So they start just blowtorching everything in this region, right? So once everything in this region gets blowtorched, the problem is you'll kill some of the microbes coming through, but you're also damaging all the intestinal cells in that area as well, leaving huge gaps in between them where actually more microbes and toxins and all that come through. And the consequence, the biggest consequence of this is this component that you see up here called LPS. LPS is lipopolysaccharide. It's a component of gram-negative bacteria. And when it's in the bacteria sitting up here, it's not a problem at all. But when the bacteria dies and releases the LPS as a free compound, and that LPS is allowed to leak through, you see it leaking through down here. When that LPS enters into circulation and makes its way throughout the body, it wreaks havoc all over the place. So this is the most clinically relevant outcome of a dysfunctional gut that leads to a leaky gut, and that leaky gut allows endotoxemia, which is the word that describes LPS now being found in circulation, right? This is where the rubber hits the road on what happens, because LPS being in circulation has all of these effects, right? All of these conditions, even things like Parkinson's and hypogonadism, low testosterone in men, chronic pain, anxiety, anorexia nervosa, depression, cognitive decline, right? Mood and appetite disorders, leptin resistance, which is a metabolic disorder, which is the main reason why a lot of people gain weight, autoimmunity, all of these conditions are impacted by the presence of LPS, right? And I'm not going to go through each one of these in an attempt to save time. But normally when I'm talking to clinicians and all that, and I go through the detailed mechanism of each one of these, right? But let me just pick one and just show you how profound it can be. Anxiety, for example, right? Everyone, suffers from some degree of anxiety as they can. So one of the ways in which LPS drives some of this anxiety is it disrupts the communication between the HPA axis, increasing the expression of corticosteroid releasing hormone. So when LPS enters into the brain, and it can enter any part of the body, it's very pervasive based on its structure, right? So it goes up the vagus nerve, enters into the brain. When it enters into the brain, it triggers an inflammatory response. That inflammatory response then activates the HPA axis, and that activated HPA axis causes a release of corticosteroid releasing hormone that then makes the adrenal glands release more cortisol, right? And so then you feel more anxious and so on. On top of that, LPS can also interfere with serotonin binding and dopamine binding at the receptor sites in the brain. So you might be making enough serotonin and dopamine, but your body can't use it well, which also drives you into mood disorders like anxiety, depression, and so on, right? So there's a lots of mechanisms here, but those are the most interesting ones I can highlight. So let's break down to a few main ways in which an unhealthy gut and gut microbiome in particular can contribute to very common chronic diseases, right? So we look at the hormone connection. Steroid hormones are your sex hormones, your estrogen, progesterone, testosterone, and so on. So your microbes regulate the steroid hormones in a very significant way. The gut microbiome influences the metabolization of these steroid hormones because a lot of that metabolization happens in the liver, then in the gut, and in both cases, the microbiome plays a role. For example, estrobolome, there is a constellation of microbes in your gut microbiome that will deconjugate or reactivate estrogen that's been dumped into the gut for removal to recycle some of that estrogen, right? So now you want some of that happening, but if your gut is very dysbiotic and you have very high estrobolome, what you'll end up with is estrogen dominance, right? And then all the complications associated with estrogen dominance. You've also got endocrine interactions. So the endocrine hormones like PYY, the very famous GLP-1, ghrelin, and so on. These are all the hormones that control satiety, fat burn, and so on. These are all also controlled by the microbiome. The release of the hormones, the binding of the hormones to the receptor sites, all of those types of steps are influenced by the microbiome. This is in part how a dysfunctional microbiome can lead to obesity and weight issues. And then when you look at other changes in sex hormones, in men, for example, there's something called the gelding principles, where it's a gut-associated endotoxin that can reduce the production of testosterone in men. Why is that? Well, when you have a dysbiotic gut, and then the gut becomes leaky, and then LPS, lipopolysaccharide, leaks into your circulation and makes its way all around, your pituitary gland sees that, and then it makes a decision that that individual is sick because they've got all this inflammatory toxin running around in their body. And as a result of that, the pituitary gland doesn't produce the hormones to cause your gonads to produce testosterone. It instead produces more cortisol or activates the pathway for cortisol because it puts the individual in a stress state, right? And it wants the individual to relax and lay down and rest and not be out there procreating. So male testosterone levels have been dropping quite significantly over the last several decades. This is one of the contributing factors where increased LPS in circulation from a leaky gut is a signal to the pituitary gland to stop stimulating the release of testosterone, or at least reduce it, and instead increase cortisol, right? So cortisol then makes you gain weight. Lower testosterone makes it harder to put on lean mass, so you do gain weight even easier. You could end up with gynecomastia. You could increase aromatization, which is the conversion of testosterone to estrogen. Then it's easier to get belly fat and man boobs and so on. And impotency and all of these other problems that stem from it, right? But it starts in the gut microbiome. Then we have the gut-brain connection, right? So the gut-brain connection is where the enteric nervous system, which is the neurological system in the lining of your gut, is connected through the vagus nerve to the central nervous system. And this neurological system in the lining of the gut, it connects to the vagus nerve, which has over 100 million neurons. It's the second most dense neurological system in the body, next to your own brain. And it has bidirectional communication. So your brain can talk directly to your gut and the microbes that are in the gut, and then the microbes can talk directly to the brain through the enteric nervous system and the vagus nerve, right? So almost every neurological disorder, condition, or symptom has a connection with the gut-brain dysbiosis or the gut dysbiosis, right? So when you're thinking about conditions like Alzheimer's, anxiety, Parkinson's, schizophrenia, and so on, even basic brain fog and just kind of cognitive decline, all of those are associated with gut-brain connections. And where does it come from primarily? Well, it's inflammation in the gut or dysbiosis in the gut that leads to inflammation that causes a barrier dysfunction, leaking in of LPS and other endotoxins, that LPS making its way up the enteric nervous system and the vagus nerve, directing inflammatory responses in those tissues. And when you have elevated inflammation in the vagus nerve or the enteric nervous system, you're going to get dysfunctional communication between the gut and the brain. So now you've got more anxiety, more depression, you've got neurodegeneration happening, you're getting loss of myelination, that's the insulation around your nerves. When you get demyelination as a result of inflammation, you get misfiring of brain signals, you get slow dopamine function and not enough energy into the brain because your liver is also dysfunctional. Thereby, you start to slow down, memory, recall, all of those issues become compromised. So, and then stress drives dysbiosis in a very significant way, driving and causing leaky gut, right? So when your gut-brain axis is dysfunctional, it actually increases your stress state and your anxious state. That increased anxious state actually, in turn, creates more dysbiosis in the gut. And then the cycle keeps continuing. When you look at the gut, the microbiome immune connection, it's interesting to note that you've got this innate versus adaptive immune response. Just to give you a quick overview on that, think about the innate immune responders as the first responders, the fast acting, but they don't actually know what they're responding to. They just know where to go based on reading inflammatory signals and cytokines and all of these chemical messengers that tell them where to go. They show up there. They don't really know who the culprit is. They're not a target specific type of defense system, but they just show up there and they blowtorch everything, right? Like I mentioned, it's like killing mosquitoes with a blowtorch. So they get there first, they blowtorch everything. They're trying to, in an attempt to kill whatever the invading species or agent may be. Now, if you stayed in the innate response, you would be very sick for a long period of time, right? When you feel sick, when you feel the fever coming on, the body aches, the loss of appetite, all of those things, those are all symptoms of the innate immune system doing its thing. Prior to the innate immune system being on, you're still infected. For example, with the cold or the flu, you're contagious and actually infected like 2 or 3 days before symptoms ever come on. And the reason for that is the virus is actually in you, replicating and infecting cells and so on. And the only time you feel sick is when your immune system starts to go after it, and it's the innate immune system. So it has these pyrogenes where it turns on fevers. It's trying to heat the virus to death, for example. So this is where the fevers and lethargy and things like that come from. Now, you cannot be in the innate immune response for more than 3-4 days, because if you are, then you're probably doing more damage than good to a lot of the tissues, because remember, innate is non-specific. It's just attacking a region. So then you want to shift to the adaptive immune response. The adaptive immune response tends to be an antibody or T cell response, and these antibodies are very specific to the target agent that's creating the problem. And so when you have shifted to the adaptive immune response, then you know internally what's happening is that your immune system has a handle on what is causing the problem. It's a virus, it's a bacteria, whatever it may be. And then now it's mobilized all of the specific arsenal it has for that virus or bacteria or toxin or whatever it may be. As a result, the innate immune players go away. They're no longer functioning, so they just take off. And when they take off, they take all of their bad symptoms with them, the fevers and body aches and pains and inflammation and all that. So you really do want to end up in adaptive immunity and have your body not only deal with it in a way that doesn't damage your body, but it also deals with it by building immune memory for the next time you come across that thing, right? So this is a really important thing to understand. Hopefully that makes sense. And know that every step in initiating the innate immune system, allowing it to function the way it does, and then more importantly, recruiting and transitioning the immune response to the adaptive immune system, all of those steps require the function of the microbiome. Without the microbiome being healthy and functional, you cannot do some of these steps, right? There's no replacing it. And so one of the things I always tell people when they talk about immune health and supplements and all that is there's not enough vitamin C in the world you can take, or elderberry or zinc or any of that stuff, to overcome the immune dysregulation associated with a dysfunctional microbiome, right? So you could take all those other herbs and supplements and all that, but you're not really going to move the needle on your immunity until you get a handle of the microbiome, because it's the microbiome that runs the central command center for the rest of the immune system, right? So you want to address the microbiome, and then the vitamin C's and zinc of the world and all that will do even better work, because now you've got a functional immune response. We've got, when you look at the direct communication between our immune system, you've got about 75 to 80% of all your immune sampling tissue is in your gut, just adjacent to the highest concentration of microbes in your gut. So constant communication. And then you can have the certain microbes from the gut microbiome being grabbed by dendritic cells and pulled across the lining of the gut and taken to the mesenteric lymph nodes, where those immune cells in the mesenteric lymph nodes will upregulate T cells and B cells to protect the body. So there's some sampling from the gut to the lymphatic system as well. And of course, dysbiosis, leaky gut, endotoxemia in the immune perspective contribute to all of these conditions. Autoimmunity, systemic inflammation, more frequent severe infections, mast cell activation, histamine, and so on. And when you look at the microbiome and metabolic health, I already talked about that a little bit, but I'll just give you just a brief overview. We talked about the twins and how there is a pro-obese microbiome, which typically means low diversity, low keystone species, low levels of short-chain fatty acids, and then higher levels of gram-negative enteric bacteria, right? When you have that kind of picture in your gut microbiome, your likelihood of gaining weight is much, much higher than if you have higher diversity, lower levels of enteric pathogens, higher levels of keystone species, higher levels of short-chain fatty acid production. If that's what your gut normally looks like, then you tend to have a lean microbiome, right? So there's a characteristic to it, and you can shift the microbiome with prebiotics, probiotics, lifestyle, behavior, and so on, and we'll talk a little bit about that. And then a healthy gut microbiome will produce adequate levels of short-chain fatty acids, which is then associated with leaner body mass. And then it also has an impact on the hunger and hormones by signaling things like GLP-1 and PYY. So the metabolic connection to me is really, really important given the huge population of people that are metabolically unhealthy. When you look at the detox capability, remember that the liver, it handles a lot of the detox of the body, but the gut microbiome is supposed to play the first phase role, where it really should be filtering out and or metabolizing things like pesticides and metals and plastics and so on before it has to go to the liver for clearing, right? So this is a very important connection as well. And the microbiome can biotransform xenobiotics and over 430 other environmental chemicals, heavy metals, and so on. And dysbiosis, leaky gut, endotoxemia are all linked to increased toxic burden on the liver, which means the liver stops producing as much bile. Now your digestive system is compromised because the liver is compromised and cannot produce enough of its byproduct. And so, you can get an accumulation of things like oxalates. You can get fat malabsorption, metabolic issues, IBD. All of these conditions can be linked to this particular dysfunction. And then you've got contaminants like glyphosate, Roundup, and so on. And many of these environmental chemicals do cause severe damage to the gut microbiome. Okay, how did we get here, right? I think you feel, rightfully so, a sense of doom and gloom, because once your gut is messed up, and probably many of you feel like your gut is messed up and has been for years, you can identify with many of the conditions we talked about. But one of the questions that we have to always ask ourselves is, how do we get here? What's a standard American diet, right? Highly processed foods, high sugar, high oxidized fats, and so on. There's no nutritional value in most of those foods. They're very calorically dense, and they don't feed the microbiome, and that's a big part of it. And then a lot of components within them actually can kill the microbiome. So that has a very negative effect. Overuse of antibiotics, even the CDC estimates that the antibiotic use is about 50% overuse. So they have a profound effect on your gut, and that profound effect lasts for a long time. Lack of exposure to beneficial bacteria. So from the time we're born all the way through adulthood, throughout the course of human evolution, we lived and ate and engaged with the land, right? Dirt in itself. And so as a result of that, we became this symbiotic, if you will, relationship with the microbes in the outside environment. Some of them are transient. They can play a role in our system. They modulate immune response. And at the same time, we're shedding microbes back out into the atmosphere. And so if we get a lack of exposure to beneficial microbes because we live in a sterile environment, we don't go out as much and all that, that has a huge determining factor on your microbiome. Over sterilization, cleaning every surface with some sort of sanitary wipe and Clorox cloth and all those, they will knock out most of the microbes in that area. But in fact, some of the more resilient ones are pathogens. And so you're almost kind of selecting for a resilient one, and then you're not building an ecosystem in your environment. Sedentary lifestyle, I think, makes sense. Poor sleep and disrupted circadian rhythm. The microbiome needs adequate sleep because it's a diurnal system as well. When you go to bed, there's other microbes that turn on that do a lot of housekeeping work and cleaning up the gut and DNA and all kinds of stuff. Those microbes function when you sleep, and it takes them a while to get their functionality done. So if you're not sleeping well, you probably don't have this effect happening within your system. High stress. Stress is one of the number one killers. It's the stress-induced endotoxemia creates significant amount of leaky gut and LPS endotoxemia in circulation. And that LPS, of course, creates all kinds of disease pathology. So what often doesn't work, right? And this is what I've seen over the last 10 to 15 years in talking to patients, clinicians, all the things that people try and all that. And there's some common approaches that just don't work that well. And here's why, what they are and why. Number one, long-term use of restrictive diets, right? Our microbiome, to me, unequivocally is designed to consume a large variety of foods in our diet, right? Humans are essentially omnivores, and as a result, we are designed to eat lots of different things. And as a result of our omnivorous type of diet, we've developed a very elaborate and complex and diverse microbiome. So if we start eating very restrictive diets, like you go just carnivore, just paleo, just vegan, whatever it may be, we're not feeding our system a large enough diversity to match the way it evolved, right? And so then you start to lose diversity within the microbiome. Now, in some cases, a specific carbohydrate diet or keto or a ketosis type diet or maybe even a carnivore diet can have a beneficial effect in a very short term. But you need to really get back to this idea of a diversification in diet, especially lots of fiber, polyphenols, plant-based materials, lean meats, all of that good stuff, but not processed and a bigger variety. We also see a lot of harsh killing protocols, right? Your practitioner may do a test, and the test may show that there's this pathogen, this and this and this, and then they go, okay, I want to kill the pathogen and then fix the microbiome. It doesn't really work that way, right? Number one, none of the natural antimicrobials are specific to pathogens. They kill lots of stuff, so they'll just kind of kill everything in the region that they dissolve, and there's no way of really controlling that, right? So you can't just kill, let it be, and then bring in new bugs, right? That's just not how it works. So too much of a harsh killing protocol can do more harm than good, in my opinion. And then most probiotics and gut healing supplements and all that and fermented foods, they haven't really done anything, right? Many of them don't really have a significant impact. There are some prebiotics, there are some other mucosal type of products that can have a measurable impact, but generally, most of the gut health type products and ingredients just don't seem to have enough data or enough understanding that it works across a broader population. So healing the gut and optimizing the microbiome can be challenging also because the microbiome doesn't really want to change, right? The microbes that are there at that time, even if they're dysbiotic, that's their home. That's where they want to be. That's who they want to be around. And so trying to change the microbiome is a aggressive process because it requires, persuasive enough variables that drives the microbes to change. Remember in the beginning, I mentioned that at the end of the day, what you want to do is make a bunch of small decisions on a consistent basis to keep driving the gut from vulnerability to resilience, right? So it's all those little decisions that you have to make to slowly chip away at the establishment of these microbes, right? The dysbiotic microbes. There's a ton of information out there and that leads to confusion and overwhelm for a lot of people. So you want to be careful there, not over-research and overlook and go down too many rabbit holes. Most probiotics and gut supplements are not backed by any research at all, which is still a shame for me to say. With Megaspore, through Microbiome Labs, I think we published 16 or 17 studies on the one product itself. Most companies aren't doing any studies at all on their product, and they may sell $50 million of it per year, but they've never invested a dime into research, which is quite sad to see. Root causes are also multifactorial and interrelated, and all must be considered and addressed. This is where a talented clinician can come in handy. We don't consider things like exercise, stress, sleep, and circadian rhythm, focusing only on diets and protocols. So we don't look at all the other aspects that influence our microbiome in a profound way. We basically look at diet, and often it's a restrictive diet, and then we look at protocols associated with killing stuff and using prokinetic agents and all kinds of enzymes and things like that. Those are all great, but we also have to consider the other things that influence the microbiome. And there's no single pill or quick fix that can do everything for everyone overnight. So just reiterating that as well. So it's all about building a resilient microbiome. We're looking at the foundations of what a resilient microbiome is. This is what a resilient microbiome looks like. If you do a microbiome test, this is what you want to see on your test. You can feel good. You've got a strong, resilient microbiome that'll probably keep you quite healthy and functioning through many more years. So number one, you want to have a high resistome. If you do the BioFX test, you'll get this resistome measure, which just means that you've got a lot of competitive microbes in your microbiome, and the resistance forces between the microbes are really high, right? Which is great because that's providing stability to the microbiome, which is good. It makes it harder to invade that microbiome. You do want high diversity. This is arguably one of the most important features of a healthy microbiome. Having, if you test, say, in your early 40s or mid 40s, you want to have 170, 180 species in there, right? And you want to keep working at it if you keep testing it and your species count is low. We want high functional redundancy, which means if you've got a set of microbes that do a job, let's say they break down oxalates, and then you happen to lose these microbes through antibiotics or some other thing, you need to have a second group of microbes that also does the same thing so it can back your system up, right? So there's a lot of functional redundancies within the microbiome, and those are important. And you want keystone species. You want really high keystone species because they're the ones that make the short chain fatty acids. They play a big role in neutralizing LPS. And the keystone species are inversely correlated with poor health outcomes. So you've got keystone species like Akkermansia, where you show good levels of Akkermansia, or at least what we would consider kind of normal levels of Akkermansia, are associated with a dramatic decrease in metabolic syndrome, obesity, and so on, right? And so there's a very important drive and correlation there. And then we want high genomic diversity as well, because remember, the microbes that live in our gut and the rest of our body, they also shed their genes to us, so that we have a higher degree of capability within our genome as well. And these are all signs of a healthy and resilient microbiome. Healthy and appropriate immune response, optimal hormone balance, solid memory, improved metabolic flexibility and blood sugar control, increased oral tolerance, and lower response to foods, and lowering your restrictions to foods as well. And you can follow the 80-20 rule, right? So I do. When you look at the 5 pillars and you look at the things that you need to be doing on a regular basis, you can follow an 80-20 rule where 20% of the time you may forget a lot of them and not do it, and so on. But then if you follow it for 80% of the time, then you're still making significant improvement, right? It doesn't have to be all or nothing. Every little bit helps. So here are the 5 pillars. Pillar number 1 is food, right? For food, the most simple thing to think about, and there's ways of diving deeper into this, is nutrient dense, diverse, colorful, which means there's great polyphenols and carotenoids in it, unprocessed, right? And organic. Organic is important because they're using more and more pesticides and herbicides on the crops, and organic bars them from using a certain number of those pesticides and herbicides. So unprocessed is key. Organic, if you can, that reduces the exposure to glyphosate and things like that. And then prebiotics or prebiotic foods are really important as well. If you just Google what are rich prebiotic foods wherever you are, let's say you're in LA or you're in New York City, and you go, what are the best prebiotic foods found in LA or found in New York City? And then you want to consume foods that have prebiotics in it. So I'm not talking about prebiotic supplements here. I'm talking about the foods that contain prebiotics that are important. The second pillar is stress. So, and let me just reiterate, in this first pillar, you don't have to do all of these things. Pick 1 or 2 of these things and focus on them, right? So add that as a normal part of your daily routine so it becomes secondhand. You don't really have to think about it. Now, the next one is stress. Managing stress is critically important for building a resilient gut because acute and chronic stress both cause an elevation in cortisol and an activation of the HPA axis, right? So you don't want that. And then it creates leaky gut as a result of that. Remember the study I had mentioned, the 2015 publication, they showed that stress-induced endotoxemia was the #1 cause of mortality and morbidity worldwide. More people are dying from stress-induced leaky gut than anything else, right? It sounds a little silly. You're like, well, no, it's heart disease or it's diabetes or it's cancer. All of those conditions have endotoxemia at the root cause, right? So you do have to do something to deal with stress as well. Then the lifestyle portion, some sort of exercise activity, socialization, great sleep, circadian rhythm, all of these things can be incorporated in order to fulfill this pillar number 3. Pillar number 4 is really about exposure, right? Getting sunshine, being in close contact with other individuals. So therefore you can share microbes and improve your diversity. In terms of early on exposure, natural birth, of course, is important, breastfeeding, and then, mom and dad, skin to skin and other types of contact with the baby, and then the family as well. Of course, you want to have minimal antibiotics and natural dirt exposure and pets. These are the beneficial exposures in this area. We are designed to be in constant osmosis with the environment around us, right? So I cannot overstate the importance of exposing yourself to natural environments with natural microbes. So going on a walk, on a trail, on the beach, in a natural environment, sitting down on a log or a rock and taking out some food and eating it, that's one of the most natural ways you can interact with the environment and bolster your own microbiome in that case. The last pillar is supplementation, right? So you want research back, so things that have clinical trials behind them, so we know they do something and that they're also safe. That's an important thing. And then it can be personalized for your need, right? You could do that in many different ways, of course, because you don't want to be taking things you don't need. You also don't want to be missing things that you absolutely need. So research back supplementations that are specific to your needs is key. You want to have the right dosing and titration, support digestion, gut repair, and microbiome diversity. These are probably the most important reasons to supplement for things that affect those particular outcomes. Now, again, you don't have to do everything that's listed here, but in order to build a resilient gut, and I promise you, it doesn't matter how complex you think your case is or how different or difficult it is. You might have mast cell activation, you might have all kinds of sensitivities and all that. You can still do something from every one of these buckets, right? So pillar number 1, food, you want to start making some changes and improvements on the food. Pillar number 2, stress. So you want to start to figure out how you can manage stress. Using psychobiotics as a supplement can also help, but meditation, exercise, whatever it may be, we need to pay more attention to our stress. Lifestyle, if we're looking at exercise, lifting, socialization, those are all wonderful things. Add one of those into your daily routine or weekly routine at the least. Gaining some sort of exposure, trying to get out and look at the sun early in the morning. Well, you don't have to look directly at it, actually. Don't look at it. Just getting out in the daylight. Going for walks, hikes, bike rides, any sort of exercise outside, rucking or whatever you may be into is also important. And then supplementation. You want the right supplements that are research backed, that have a specific function in things like supporting digestion, repairing the gut lining, improving the microbiome by adding diversity, and so on, right? So you have to pick something and do something in each of these 5 pillars. And I promise you, as you keep doing them and you add more and more things from each of the pillars, you will be pushing your microbiome to full resilience, right? So here's a recap. A lot of health issues and have gut issues that come into play. This includes everything from your brain health, memory, mood, hormones, and so on, right? We beat that horse even after it was dead. And then, of course, the way in which dysfunctional guts lead to clinical issues is through leaky gut or endotoxemia, the presence of LPS in circulation. And the root cause can be a number of different factors, but there's these interrelated things like processed food, sedentary lifestyle, antibiotic exposure, over-sterilization, and so on that are common within many of these. There are many challenges to healing, right, including confusion, different information, so on and so forth, and maybe a lack of progress in general may be demoralizing, but I can promise you, if you start incorporating the 5 pillars and you understand the pathology of how the gut is driving these functions, I think you'll be able to make a significant amount of progress in your own system. It's all about resilience. We want to build resilience where we don't have to be 100% perfect all the time in order to feel good and healthy. You want to have 80-20, right? 80% good decisions, 20% bad decisions. That's how I live my life. Fortunately, I don't suffer from any gut issues. I used to in college. I had really bad, what probably was like IBS like symptoms. And then once I started getting into the world of microbiology and the microbiome, I started figuring out how to repair that. And it's never been a problem since. And I can, have days that I'm off and eat a bunch of things that are probably not good for you and still not have to pay for it because of the resilience. And the 5 pillars of building resilience are food, exposure, lifestyle, stress, and supplementation, right? You want to do something in every one of those pillars. So I imagine many of you can identify with a lot of these issues, right? Many of you are challenged with and or dealing with most of these types of conditions and probably have been for a long time. And then, as a result of that and seeing that after interacting with thousands upon thousands of people online at conferences, everywhere that I travel, it's become clear that people aren't resolving their issue often enough because it is a dismantling or dysfunction in the foundational things you should be doing, right? The 5-pillar type things. So we wanted to create this course, which is my first ever public course. I've just been teaching as individual lectures. And of course, the information is kind of not well organized all over my page. You can scroll through it and find lots of things, but I wanted to put the last 10 to 15 years worth of knowledge all into a very digestible, no pun intended, course so that people can follow it, get trained and learn how the digestive and immune system works from mouth all the way to the bottom. We go through each one of those segments. We talk about the microbiome and their role in each of those segments, what tends to go wrong, like what creates dysbiosis in that area, and then what does it look like if you have dysbiosis in that area, what are the symptoms and so on, because we also want you to be able to use the information to try to identify what part of your body is mostly dysfunction, right? It becomes easier to deal with it. And then also when your doctor makes recommendations, it's easier to follow it because you have an understanding of this, right? So that's the comprehensiveness that we put into the course. And so we call it Build Your Own Resilient Gut. I'm really proud of it. It's kind of a labor of love because, as many of you know, I love to teach, and I'm out there lecturing and teaching and sharing as much knowledge as I can all the time. So being able to put this in a course format that people can follow from beginning to end and then themselves become really well educated on the digestive system, immune system, endocrine system, and then the microbiome and all the things that impact it. That's a wonderful thing for me to be able to share that with everybody. So the system of the course has over 50 recorded lessons, over 10 hours of lessons. So these are all shorter lessons. When we did it in the fall as a beta test, we had about 600 students that joined up, but each of the modules then was over 90 minutes long, right? So although people just absolutely loved the course, you'll see the comments that we'll share later. What was also apparent is that often it's too heavy. There's too much in one module for them to really wrap their head around. So we took all the modules, the 5 modules, and broke them up into 50 smaller lessons, right? So it's 1/10 the volume in each of the lessons, right? So instead of sitting through an hour and a half lecture, you can basically sit at your own pace, 10 or 15 smaller lectures. And with each of the smaller lectures and lessons, there's actionable steps, there's links to products that might impact that outcome of that particular part of the gut. There's action steps that you can take to improve that area. Lots and lots of resources with each of it. Here are the 5 modules that we had created. Module 1 was Microbiome Essentials. So we really go through the microbiome, how it regulates digestion, so on. Then we do Gut Health 101, which is a deeper dive into the digestive system, how each part from stomach acid to bile to enzymes, how all of that works together, and how do you work to support the health and vitality of the GI tract. Practical action steps, for example, optimizing and so on. Then the next one, we learn about leaky gut and endotoxemia. So how does this leaky gut happen? How it's linked to virtually every condition, a more elaborate version of what I just did. and what is the result of endotoxemia. Then I also look at common GI issues. So 25 plus additional lessons covering common GI issues. So then you can understand what is going on in reflux, for example, or SIBO, or bile insufficiencies, bloating, gas, IBD. What is that? What's going on? What does it look like? What is wrong with the microbiome in all these conditions, and so on. So there's a lot more of all of that coming up as well. Then we have tons of tools and guides, right? So these are microbiome assessment tools, checklists, shopping guides, digestion checklists, leaky gut repair guide, symptom checklist, and we'll go, actually, when you go through the modules, you'll be asked to pull out your symptom checklist and check off the symptoms you have. And based on where you are in the module, it'll help you identify what may be the cause of your symptomology, right? Is it reflux? Is it your stomach? Is it your small bowel? And so on. We also give you supplement guides and protocols that you can use to help, SIBO and bowel support guides, and so on. So there's a ton of guides and resources that go along with it, and lots more that go along with the course, right? So here's the total course package: 50 plus recorded videos, all downloadable MP3s, so you have them forever. You can keep them forever. You can follow it on your own pace. You don't have to follow it in any particular accelerated format. You also get all the transcripts, so everything I say on the course is also written down in a transcript for each slide in each lesson, and then 15 plus guides and tools and checklists and so on to implement when you learn, so that it's easier for you to take action towards improving your microbiome. We had a lot of great feedback from our beta group. We had a lot of people telling them it's the best money they've ever spent, and they agreed to the huge benefit of the course, because we're empowering them to understand better about their gut, and then giving them the ability to figure out what's going on and potentially even improve their condition by themselves. She is a student, Danielle. She's a registered nurse or a practitioner. We had a number of practitioners on the course. She said she's taken multiple courses and trainings over the years as a health coach, nutritionist, and former registered nurse. She was kind enough to say that this one was the best one ever taken. I'm very passionate about learning, teaching, and learning too, and then teaching and making it understandable for people, right? So lots of great comments for all that. And then there is a bonus that you get to exercise if you do it in the next 48 hours. Number one, this part comes with the course, quarterly exclusive live Q&As, because lots of people generate questions as they're going through the course. We want to be accessible so people can ask us questions as they go along. So send in your questions every few weeks, and we'll do a live Q&A every quarter so that we have enough interaction, enough time to answer all the questions. And we'll do that indefinitely, right? I've already done, I think, 4 or 5 live Q&As from the first group of students that went through, but we're continuing the live Q&A as we go along. So you'll have time to...
That's crazy, Kiran. Crazy.
Right? I just dedicate my time.
Crazy.
And most of them go
Y'all,
almost 2 hours.
You know how Kiran is. That's nuts. Like we were on, so this isn't my course. This is sponsored by Rebel Health and Kiran, but I love Rebel Health and I love Kiran and I love you. So I'm hosting this. But when I heard that they were talking about doing the Q&As into perpetuity, I was like, zoinks. Bless you. Bless you.
Yeah, thank you. And that's the part that people can't get enough, because you'll have questions, you'll have things about your own self and all that you want to ask. Bring them to the live Q&A. We answer everything. Here are 4 bonus modules you get. One on genetics and its impact on the gut microbiome. Michael does an amazing one on stress reduction, mindfulness work, and all that. Remember, that's one of the very important pillars. So you get a lot of tools and guides there. Dr. Berhena does one on oral microbiome. Actually, it's a conversation between me and him when we really go through the oral microbiome. And the last one is a light and quantum biology in the microbiome. Very, very interesting, from Dr. Carrie Bennett. And then I have a bunch of advanced training courses for those that want a deeper dive. These are the training courses that I've done, or training presentations I've done for clinicians. We've put around a $200 value, because a clinician will spend upwards of $200 to come to one of these presentations to get CME credit and all that. We're going to give it to you at no cost at all as part of this early bird special. This is the super bonus in addition to the other bonuses, if you get everything within the next 48 hours, right? So this is the 48-hour bonus that you get overall. So this is everything as a recap. I'll leave it up here. Well, actually, we'll come back to it because there's another one because I want to show you the actual pricing. We got all kinds of recommendations for how much you have to price this. We've slashed it, gone down. We want to make it affordable and for everybody so they can do it. So it's only $347 for all of this. Everything that you've seen so far, the live Q&A, the actual course, the live Q&A, all the bonus modules, and then in the next 48 hours, all the early bird specials as well. So it's a 37% off the normal price, and it's $347. And we're working with Shivan on this. So this is everything. I Shivan, I'm sure you've put the link of where to get this.
Okay, I have.
Right?
I have. Yep. You guys, I'm going to ask you just to go ahead and stop sharing for just a second, because I just want to talk to you for a second. If you go to the chat, we're running out of time, so I want to just tell you this. If you go to the chat, you have the top link that you'll see there on the bottom of the chat is the link to the course. Then you have another chat link to the course. Then you have, so I've done 29 trainings with Kiran. Did you know that? Like, a lot of you have been coming to them for years. We put it all together for you. And if you purchase through my link, because that helps to fund our work at SIBO SOS and Chronic Condition Rescue. So I'm asking you to support my work by doing these webinars with you, et cetera. So using my link would be greatly appreciated. It doesn't raise your cost at all. Then you send us to proof of purchase that you're shopping for it with my link to info@sibosos.com. We will send you the 29 trainings that I've done with Kiran. So right now, if you do that, like right away, you're getting those 29 trainings with Kiran. Please email us immediately once you make your purchase. So like in 2 weeks, I'm not getting those emails because it's too much. And I have a very small team. And then also the other bonuses that he was talking about. Now, stand by, recording. So with that being said, check out all the links right there. If you purchase the course in that time frame I was just talking about, then with my link, you can send the proof of purchase to info@sibosos.com. That's in the chat. Now, this is so mean. We're over, and we have like 5 minutes for questions. I'm so sorry. I tried to answer as many as I could. So are you ready, Kiran? You ready?
Yes. Fast. Yes. We'll do fast answer.
Fire, my friend.
Yes.
So fast. For someone taking Protonics and have been told need to continue forever as have Barrett's esophagus, I am aware that this medicine can contribute to gut problems, perhaps leaky gut. Any suggestions?
Yeah, I think you probably have to stay on it forever. And of course, talk to your doctor about that, right? It's not a decision you should make on your own. But nonetheless, you can negate the negative effects of it by doing things like diet, stress management, prebiotics, probiotics, and so on. On its own, it can over time create an issue with your microbiome, but you can easily overcome that by specifically going after diversity and resilience in your microbiome. So you might need to stay on the medication, and that's fine. You can do things to help your microbiome.
And that's the point of the whole course. What you can throw any condition at Kiran. The whole thing goes back to that. So obviously there are different medical conditions, but you can't lose by having a diverse, healthy microbiome. It is so helpful for everything. And so that's why, start there and really end there, and then talk to your practitioners and get those tests. So for the Biome FX, which by the way, you could get at 15% off, I did put my link for Microbiome Labs as well in the link in the chat. Do you know if it tests for LPS levels and calprotectin levels, Kiran?
It doesn't, but it looks at microbes that produce a lot of LPS. So if you have a dysbiotic gut and a potential leaky gut and high levels of microbes that produce LPS, it's basically indicating to you that your microbiome is very pro leaky gut, very pro LPS.
Okay. If you don't see anything in the chat, you don't see anything in the chat. It says, so the account owner and everyone in the meeting can see and save messages sent to everyone. I don't know, but I will pop. Y'all don't, some people can see it. Can some people see it in the chat? I am popping it like Mehul. I'm putting this in there for you. Hey, Cam, is there a way to measure histamine sensitivity? Have continued bloating after addressing other issues? Cam, good to see you here. Of course I remember.
To measure histamine sensitivity. So there isn't a standardized test that says here's your degree of histamine sensitivities, right? It's a lot of it is really based on symptom response to things that you might eat. So let's say you've got a trigger food, a food or substance that you know will always trigger a profound histamine response. You can use that as a benchmark to try to see if you're improving on your histamine response, but use the same thing every time, because what you want to see is how your system modulates response to that one thing. If you use different foods each time, you might get a different response anyway. And there's a time period in which it takes your body to figure out how to tolerate most things. So I would use your own symptomology. Don't overload it. A little speck of something that might give you a histamine like irritation, you can absolutely use that as a way of measuring the symptoms.
Okay. How do you restore your gut after antibiotics?
So we address that in great detail in the course. You can absolutely do it. We talk about what happens to your gut microbiome during antibiotics, what is actually dysfunctional, and then how you do it. To give you a short form of that, it's a combination of probiotics, prebiotics with the right timing, and then diet plays a big role in it as well, right? So, but you absolutely can. You can absolutely fix your gut after antibiotics. Even if your antibiotic course was 2 years ago and your gut is still dysbiotic, you can fix it now.
Awesome.
Right? And that's exactly the type of info we empower you with.
Let's put some love into the chat for Kiran. Thank you all so much for coming. The hundreds of you that came. Thank you so much. We love having you. Kiran, you did a beautiful job as always. Thank you so much. Love having you.
My pleasure. Thank you, everybody. And we'll see
hopefully
a bunch of you in the course and the Q&A. Thank you.
Q&A is nuts. Into perpetuity? What? Don't hold him to it for in 35 years. Hey, Kiran, what's the quarterly Q&A?
So everyone will have a resilient gut and will live forever. So we're gonna have Q&As into our hundreds. So
individual results will vary. Goodbye, Kiran. I love you.
Thank you. Bye.
Bye-bye. Thanks everyone for coming. Please grab those links. We are going to send a replay tonight. We did also send the link during the webinar. And what a delight to have you all here. What a delight to have access to this really specialized information. I love that they went through and they chopped the course up so that it's even more bite size. You can just play it on demand, then getting your microbiome back after antibiotics, etc. One thing, when somebody was asking about what fermented foods are safe, fermented foods are going to cause a gaseous reaction. So if you have a lot of bloating, I get that you want to have your probiotic type, repopulation, that kind of thing. But I would, and Kiran and I have talked about this multiple times, you want to go slowly and don't be overly attached to the kimchis and that. There are other ways to get that diversification. And literally, if you are like an eighth of a teaspoon of sauerkraut juice, don't have a whole serving if you're already super descended, super bloated. You're trying to get your microbiome back online. This is what the course is all about. Because I hear about people just torturing themselves, thinking, and I did this to myself too. Oh, an apple a day is going to keep the doctor away. Oh, I'm going to have this, sauerkraut, this kombucha, whatever. And just not going well. Your gut can't handle it yet. But a little bit, like a micro dose, maybe okay. Megaspore would be beautiful to start slowly but surely. So those are just some pieces of advice after coaching so many people in SIBO SOS with Dr. Allison Seebecker and doing so many of these, etc., writing my book, Healing SIBO. That's the advice we consistently give about fermented food. It's beautiful. It's amazing. But you want to really make sure you can handle it so you don't torture yourself and build up. Okay, that's it for now. Allie, do you have anything else that I need to say that I haven't had a chance to mention? I want to thank you all so much again. Seriously, I really appreciate you. Thanks, Melinda. Thanks, Sherry. Thanks, Tanya. Y'all are the next levels. That's right. So are you. Hey, Edith, glad you came. Great. Oh, Carla's saying, I bought the beta, the first one that they did last year, of course, and it's fantastic. Highly recommend it. We'll be going back to it as a reference over and over. Plus, you're getting all those Q&As. That's really nuts. Dr. Seebecker does that for her pro course. You sign up for her pro course, and to the best of our knowledge, she'll be continuing to do pro course SIBO Q&As. I think she's the only person I know who does that. and now Kiran and Michael are doing that into perpetuity for like no extra charge. Like I talk to Dr. Stiebecker all the time about it. I'm like, are you sure? Like that's a lot of work. Yeah, no, it's good. It's good. It's good. Great. Awesome. I love it. Give the value. Give the value. That's what they're doing too. So it's remarkable. And I'm so glad you're here for it. Okay. I have to go. Many blessings to you all. Stay well. Stay the course. Inch by inch, it's a cinch. Don't give up. Okay. There are a lot of answers out there for you. These gut conditions can lead to a lot of anxiety, a lot of hypervigilance, a lot of cynical thinking. I know I've been there, but I also know that there are answers and there is hope. And connecting you to Kiran, a truly world-renowned, astonishing teacher and microbiologist, what an honor. I'm so glad I'm part of your healing journey, and I appreciate it. Naveed, go ahead and email us at info@SIBOSOS, and we'll catch you next time. Thanks, everybody. Bye.